next presenter, Dr. Vimisha Amen. Please.
Good morning all. I am Dr. Vimisha. I will be talking about Good morning all. I am Dr. Vimisha. I will be talking about intracranial space occupying lesion in neuro-ophthalmology. %60% of patients with intracranial space occupying lesion present with ophthalmic manifestation, and they constitute one most common reason for neuro-ophthalmology consultation worldwide. Objective of our study is to evaluate myriads of symptoms in neuro-ophthalmology in a patient with intracranial space occupying lesion. Also to highlight the role of ophthalmologists in early diagnosis and prompt management of brain lesion with a multidisciplinary approach. In all patients, detailed history, refraction, slit lamp examination, neuro-ophthalmology evaluation, and fundus examination done, and neuroimaging done for all. Our study is a retrospective descriptive study which conducted in a tertiary healthcare center in South India. Over a period of 1 year, around 30 patients were recruited, and all patients above 16 years of age with a lesion confirmed by neuroimaging are included in the study, and patients with pituitary macroadenoma and cerebral metastasis were excluded. Coming to result, out of 30 patients, 20 were female, and mean age of our study population was 47.5. On analyzing the result, most common presenting complaint was diminution of vision, followed by headache, field defect, and diplopia. And headache was the most common neurologic symptom presented in 23% of individuals. Coming to discussion, after analyzing histopathology and neuroimaging, we found that most common primary lesion in our study population was meningioma, which found in around 40% of individuals, followed by schwannoma in 30%, glioma in 13% of individuals. Analyzing symptomatology, meningioma patient mainly presented with the optic nerve head pallor, papilledema, and field defect, and schwannoma patient presented with the papilledema, diplopia, 7th, 5th, and 8th cranial nerve palsies, and glioma patient mainly presented with a headache, multiple cranial nerve palsies. It's a coronal T2 weighted image of one of our patients having parieto-temporal heterogeneous mass suggestive of transitional meningioma, and the patient with the axial flare image showing homogeneous mass in supracellular region suggestive of tuberculous cellular meningioma. Fundus image of another patient with optic nerve head pallor who had cellular tumor. It's our case of trigeminal schwannoma with a Meckel's cave extension. In conclusion, nearly 2/3 of our study population had poorly neuro-ophthalmologic manifestation as major complaint, which implies eyes are indeed windows to brain. And cross relationship of other disciplines such as radiodiagnosis, neurosurgery, and pathology can go long way in our clinical practice. Limitation included in our studies were absence of radiology, neurosurgery facilities in our center, and thus patients with the financial constraints were having trouble going through expensive imaging modalities and regular follow-up. Those are my references. Thank you.
Good presentation. Thank you very much. Eye is a window of the brain, and eye is also tail of the brain, isn't it? Yeah. Eye is the only organ where you can see live vessels and things like that. Any periventricular leukomalacia or cerebral palsy or these kind of children were not included in this study? Did you include them? No.
No.
Yeah. Okay.
How was the fundus findings? Like both, there was papilledema. Both is. Any unilateral disc edemas did you made out in these cases? Any one disc was involved? Unilateral disc edemas? No.
Thank you.
We should wait for them
Yes.
to start.